Hi and welcome back to Antai Hospital's YouTube channel, and today we'd like to continue on the topic of ovarian cysts. Yesterday we talked about ovarian cysts, the small ones. Now today's topic we'd like to talk about another distinct ovarian cyst type, which is massive ovarian cysts. Now their entire nature is very similar to normal ovarian cysts, only that massive ovarian cysts are massive. They can grow up to several kilos in weight, up to 5 to 10 kilos, even higher than that, and they exert massive amounts of pressure on the lower abdomen and also the pelvic cavity. Now, massive ovarian cysts are quite obvious. They are not much different in this point compared to their smaller counterparts because they cause bulging in the belly area, in the lower abdomen, immense pressure as well. So not only does it affect your menses cycle, you might have some irregularity, may or may not have some irregularity. Furthermore, it may affect your ability to get pregnant because the egg cells released are of lower quality as well, and it can potentially lead to recurrent miscarriage as well, as we've explained yesterday how it leads to miscarriages. Furthermore, if you do manage to get pregnant with an ovarian cyst, this massive ovarian cyst present in the reproductive area can lead to immense pressure on the pregnancy. Now this can lead to what we know as a pressure-induced miscarriage because of how immense the pressure is on the womb. The baby is sort of restricted in its growth. It's unable to expand and grow properly because there's restrictions. Furthermore, nutrients have been taken away by the cysts, blood flow as well. It leads to much more malnourished pregnancy. So even if it does survive, it will lead to some form of problems later on with the child's development. Very likely it will lead to high risk pregnancy, leading to a potential miscarriage. So it is indeed very critical. So for a massive ovarian cyst, as I've mentioned, it's very obvious to detect this. Before we go for imaging, just ask yourself a few questions. Do you feel a massive growth, massive pressure on your lower abdomen in your pelvic cavity, and is it visible? You do not seem to consume massive amounts of calories, but you have a bulging in your belly. People assume that you are pregnant, but you are not. This could be a presence of a potential massive ovarian cyst. It may or may not be that case, but it's a very safe bet for you to go and get diagnosed. And it can easily be diagnosed just using ultrasound imaging and other forms of imaging diagnostics. For example, even using laparoscopy, we can immediately directly visualize the presence of this cyst. And we will need to remove it using laparoscopy and hysteroscopy in a combination surgery to ensure that this cyst is completely removed without any remainder at all, because if there is any potential remaining cyst in the cavity, it can lead to a recurrence, and we can avoid that using Antai Hospital's 414 surgical treatment system. That's how we can ensure no recurrence, no more infertility or recurrent miscarriage, and we can have natural pregnancies after that. The most clear observation that you'll see is that you will see that your pressure in the lower abdomen cavity has been released upon removing this massive cyst. So you see much more relief, much more better quality of life, because you weren't realized that there was such a massive amount of pressure in your lower abdomen. Furthermore, you will also see that you lose significant amounts of weight because of how massive this cyst is, depending on how big they can get, and they can get to the size of watermelons as well. Those are the more larger types on the extreme spectrum, but they are massive. That's why they are called massive ovarian cysts. So I hope this video has helped you in understanding massive ovarian cysts, how you can look out for it, and how they affect your fertility and pregnancy goals. If you do want to achieve a natural healthy pregnancy, if you want to restore your menses cycle, you will need to have this massive ovarian cysts removed. Although they are benign, although they are not harmful to you or have no any malignant root, they will continue to grow in size, compete nutrients and blood flows in the reproductive region, competing it with the pregnancy as well, and it can affect your fertility and your ability to have a better quality of life, because it just builds up a lot of pressure there, and you will have difficulty and pains in the lower abdomen. So please visit the website for more information on massive ovarian cyst removal using Antai's 414 treatment system, and look forward to the next video. Please leave me some feedback below, and I'll see you in the next one.